Hello and welcome to this special broadcast. I am 𝗟𝗓𝗓𝗓 and today we are going to discuss about knowledge and awareness on diabetes. And to know more on this, we all know that diabetes has become very common nowadays. In every household, there is at least one diabetic patient, isn't it, viewers? So to discuss more on this, today we have with us in the studio Dr. Nasimur Riaz, consultant diabetologist of Northeast Diabetes and Obesity Research Center in Ulubari. So, doctor, welcome to the show.
Thank you.
And thank you so much for joining us today.
Yes.
So, doctor, first of all, tell our viewers what is diabetes and what are the different types of diabetes?
Yes. Diabetes, it's a metabolic disorder where what happens if, I will explain you so that the layman can also understand. The definition should not be a medical terminology. So, it is a condition where the blood sugar abnormally high and it is due to increase in blood sugar. And the reason is in such patient there is a hormone called insulin. So, diabetes is due to decrease in insulin secretion or increase in insulin resistance.
Right.
So, people may have insulin deficiency or might be the resistance is high or people might have both. So, this condition causes diabetes. So, if we talk about diabetes type, many people ask us also, sir, which type of diabetic I am? So, basically diabetes is two types. In broadly, if you can say, number one is a type 1 diabetes. Type 1 diabetes is a condition where there is sudden, the insulin production become like it suddenly stop. The insulin production, then people become diabetes, and usually it's occur in younger age group. Normally, the children of 8, 9, 10 years, they usually diagnosed early in the life, but it may occur to anybody at any age. It may happen, and the treatment for type 1 diabetes is only insulin. Means entire life till for survival they have to depend upon insulin. Another type of diabetes that is called type 2 diabetes, which is most commonly in every household, as you have said. So, it is the commonest form of diabetes that we used to call type 2 diabetes, or nowadays we also tell is a lifestyle disease also. So, in type 2 diabetes, the insulin production never becomes zero in the early phase, it decreases or insulin resistance increases. Means the people have insulin, but they are because of resistance their body is unable to utilize that insulin. And such type of diabetes initially we start with tablets or insulin, or both tablet and insulin can be a part of the treatment. Another special type of diabetes that is called a gestational diabetes, that is diabetes during pregnancy. And it's like a woman before pregnancy, it's she is normal, but during second or third trimester her blood sugar goes up, that is called gestational diabetes, and that is also nowadays very common. So, that time if the blood sugar is not controlled, then it may be dangerous for both mother and the newborn. But interesting fact is in gestational diabetes, once the delivery baby is born, the mother again become normal. But if such GDM cases or those who are having gestational diabetes, in future to become type 2 diabetes, the probability is always more as compared to a non-diabetic pregnant woman. So, they have to be more cautious about their diet and exercise.
So, doctor, what are the early signs or symptoms of diabetes? How would people know that, he or she is a diabetic patient? So, what are the early symptoms?
Yes. So, you will be surprised as per the government data, majority of the people, they don't have any symptoms. So, if we talk about what symptoms, what patient will feel when they will have diabetes, as per the government data, 57% patients are unaware that they are diabetic. Means they don't have any symptoms.
It's asymptomatic.
Asymptomatic means majority of the people might not have symptoms. Other than if the patient develop symptoms, or then the symptoms might be in the form of polyuria, that we can say that is frequent urination. They used to go to toilet very frequently. They used to wake up at night to go to urination. They might feel thirsty. They drink 4 liters, 5 liters of water. The hunger level goes up. They keep on eating food whole days, and even though there is a weight loss, if there is a wound or any form of infection, it get delayed. Wound healing get delayed, and people may feel weakness, dizziness, and some may experience some form of irritation. And another interesting fact that there is a infection or itching in the private part, that might be one of the symptoms. And the very interesting part is that whatever symptoms I have said, it not necessary that every person will have the same symptoms.
So
might be
symptoms,
yes,
yeah.
might be people may not have any symptoms. There might be some patient who have only itching in the private part, rest they don't have any symptom, and when they check the blood sugar, it may goes 300, 400.
So doctor, what are the common health problems that a diabetic patient faces?
Yes. So basically, as we all know, diabetic is a pandemic. It is everywhere. So I usually don't make my patient get scared. So basically, diabetic patients are normal human beings. They don't have anything different than the rest of the people. They should not behave like diabetes is a disease. It should be a normal condition. Yes, if the diabetes is not controlled, it may lead to long-term complications. So, 2 factors all diabetic patients should be aware of. Number 1, there are some acute situation they may encounter. Acute situation, what happen, we call as hypoglycemia. If any diabetic patients who are on medication or on insulin, then they should not skip their meal. Otherwise, their sugar may fall to abnormally low level. That is called hypoglycemia. That is an acute situation. Another is if the blood sugar is not controlled over a period of time, it may lead to long-term complications like involving the vital organ like eyes, people may have blindness, amputation, heart disease, people may have stroke, kidney disease. So these are the things which are the long-term complication of diabetes. But itself diabetes is not a, I tell my patient you should not behave like you are a diseased person. It is an uncontrolled state. Earlier, if the person is not diabetic, the entire glucose mechanism is controlled by the own system. But once people become diabetes, then own system is compromised. Then they have to control by their mouth. They have to control their food. They have to do exercise to maintain all these things. Otherwise, they can be a normal human being as compared to a non-diabetic patient.
Right. So how can diabetes be managed better in a very simple way?
Yeah. So a basic rule, what we have learned in a book, when we study, diabetes management, the first treatment of diabetes is always diet and exercise. Plus minus is the treatment. But what happens when we a patient diagnosed with diabetes, in the early phase, if a doctor advises do this exercise, don't eat this thing, they do very religiously. And the blood sugar get controlled. But over the period of time, they get relaxed, they only depend upon the medicine. So I will tell the viewers that the first treatment of diabetes is always diet and exercise. After that, the medicine come. So if someone is a diabetic for a longer period of time, the only diet and exercise will not able to control the blood sugar 100%. Right. But even though the treatment should be always diet and exercise plus minus medications.
So, doctor, which one is more preferable, taking insulin or, taking pills during diabetes? Because, there's a myth. People mostly say that if a diabetic patient take pills regularly, then it might affect the heart or something. There is a myth. So, insulin is more preferable. They say there's a myth. So, according to you, what should, a diabetic patient take regularly?
So, the myth is in the both sides. Even when we prescribe insulin to patient, people said, now I am in the last stage of diabetes as you are prescribing me insulin.
Right.
So the basic is that be it a tablet or be it insulin, the blood sugar should be under control.
Okay.
Because whatever oral tablet available in our country, it is approved by the government authority, and it has lots of research study. Then only it's able to being registered practitioner, we are allowed to practice or write that medication. So all medications are safe, and insulin are safe. It is when we see a patient after examining all his reports and evaluation of entire history, we decide what will be the best for the patient. There are a few patients who are taking 4 times insulin a day, but blood sugar is more than 200, 300. So it doesn't mean that if he's taking insulin, everything is okay.
Right.
Same with the tablet. Many the myth or there is a confusion among the patient. If I continue take the tablet, my kidney may get damaged. But they should understand that tablet or the insulin is been prescribed by the doctor. The reason they should have blood sugar under control. And why we want to have blood sugar under control is to prevent the long-term complication. We want to save the kidney of the patient. We want to save the heart. We don't want our patient to have a stroke. That's why we give medicine, so that his or her blood sugar be under control, so that he can prevent.
So basically, it depends on person's body, isn't it?
Exactly.
So whether to take pills or insulin.
Exactly.
All right, viewers. So we will discuss more on diabetes, about its food habits and many more. But now it's time for a very short commercial break. I will be right back with more discussion on diabetes. Stay with us. Welcome back, viewers, to this special broadcast. So, as I've already said, that today I have with us, well-known diabetologist Dr. Nasimur Riaz. And before going to the break, I said that now I'll be talking about the food habits of a diabetic patient. So, doctor, please tell us about food. Which are the food items that a diabetic patient should consume or avoid?
Yes, food is a very interesting topic in diabetes practice, because we always feel surprised. People are like diabetic for 10 years, 15 years. Whenever they come to see a doctor, they again keep on asking, sir, what food I can take, what food I should not take. And the interesting fact is, in our place, people used to have rice as a staple food.
Right.
So can we take a rice or not?
So most common question. Yeah.
Yes. So I will give you an example, like the people who are living in northern part of the country, like Haryana, Punjab or Rajasthan, their main food is chapati or roti. They hardly take rice, even though they are diabetic. It doesn't mean taking only chapati, or if people take rice, then they will become diabetic. So the interesting part is that we advise diabetes patient to avoid a simple form of carbohydrate that is not good for them. Like a measurement called GI index or glycemic index. It is a measurement of the food. Like if we talk about a particular food, what amount of sugar that food will raise after 2 hours, that is called glycemic index or GI index. And it's count from 0 to 100. Sugar is 100, and if you take egg white, it is 0.
Right.
So we advise diabetic patients should take foods which is low or moderate in GI index. Normally, any food below 55 is low GI index. If you talk about rice, it is around 77. So, but it doesn't mean that diabetic people cannot take rice. But the way they has to take, it is we like diabetologist or dietitian has to educate them. For example, if you take a thali of whatever we take, so half of the portion should be with vegetable, green leaf vegetables. it should contain minimum half of or 50% of that. Remaining 50%, 25% should have a protein content, be it in the form of fish, egg, meat, or for vegetarian they can have paneer. And that another left 25%, the remaining 25% has to be with carbohydrate.
Okay.
That include rice. So in that scenario, if diabetic patient can take, so they can take twice daily, even thrice also. If they want, they can take.
So it's very interesting. So the talking about the food habit, well, it's a myth, you know, in every household who has a diabetic patient that you cannot consume right. You have to, you cannot eat rice during, you know, at night. You have to eat chapati.
Yes.
So this is a myth. So it's all about you know, management, food management.
Exactly.
So it's 50%, 25%, 25%,
Yes.
50% vegetables, 25% protein, either in form of fish, meat or egg, and only 25% of rice. So a diabetic patient can consume rice, but in a very smaller amount.
Exactly.
As our doctor has said, that only 25% of rice a diabetic patient can consume regularly, isn't it?
Exactly.
All right, so that's very interesting.
So it's not like dieting,
Huh.
or there is called a diabetic diet.
Right.
It should not be. It should be a balanced diet.
Huh.
Everybody should have a balanced and healthy diet, and that includes rice or all sorts of vegetable, all sorts of fruits they can take. And they should not be, I always tell my patient in kitchen, there should not be two type of food. One for like my diabetic patient, and mom is cooking, like suppose father is diabetic, for him the food preparation is different than the rest of the family. It should be a same for everyone.
So, doctor, you mentioned about fruits. So, we all know that, you know, a diabetic patient should avoid sweet. But most of the fruits, they are sweet, talking about
Exactly.
mango or pomegranate, anything.
Exactly.
So, you know, what kind of fruits can a diabetic patient consume?
See, as we are talking about rice and this thing, our main concern is carbohydrate, the sugar content. But the interesting fact is that the human body is survive only energy we get it from the carbohydrate. Without carbohydrate, or we can say without sugar, we cannot survive more than 5 minutes. So ultimately the entire energy is from the glucose, what we used to take. But if the people become diabetes, we ask them or we try to like educate them, they should avoid a simple form of carbohydrate. If we talk about fruits, I always advise my patient to have fruits which is seasonally available. Like now if the season of orange is going on, so they should take orange in a moderate quantity. And as if it is not been like, suppose if the patient is having diabetes and kidney disease, then the thing will be different. It will be nephrologist who will be deciding this fruit you can take or some fruit the patient need to avoid. But in simple diabetic patient can have all the seasonal fruit, but in moderate quantity. And remember, they should not take it juice. It should not be in the juice form, it should be in the raw.
Okay.
Because what happens if someone take juice, they take the energy, they take the entire thing, but the fiber part, they like it's gone. And what happens if we take anything to digest that thing, body needs to have like expended some energy. Body need to do some work to digest this thing. And if you take juice directly, body need not to do anything, just that body need that energy. So in diabetic, we ask our patient to avoid juice, as that can be replaced with the raw fruits.
Okay. And so, how often should a diabetic patient eat throughout the day?
Yes, that is also very important. All diabetic patients, basically those who are on medication, they should have food or anything in regular interval. It should be 2 to 3 hours. They should not skip meal. If they are on medication and if they are on insulin, they should not skip meal. It should be anything within 2 to 3 hours.
So, after every 2 and 3 hours?
And they might, suppose they had breakfast at 8, say at 11 they have 1 apple. Same they have lunch at 1 or 2, that at 4 or 5, mid-meal type of some like take almonds or any nuts, they can have. And it should be advisable they should have.
So, should they take their dinner early? Is there any, you know? rule or
So,
something?
taking dinner early is very it's have lots of health benefit. It is not like all diabetic patients. It is for diabetic. It is for everyone.
Everybody, of
If you
course, yeah.
take dinner early, the digestion will be good. Because what happens normally, we take dinner and we go to bed, then there will be a digestion problem. So early dinner is very good. If you take early dinner, then we wake up early also in the morning.
So, will losing weight help in control of diabetes?
Yes, weight, the way diabetes is growing, obesity is one of the important factor or increased weight. So, if we come across any patient who is overweight or having obesity, our target is to reduce his weight only, the first target. Once they lose weight, the diabetic also get control. So it is very important. Obesity has to be taken care.
So you can walk every day, walking or
Yes.
going to the gym or exercising. Is it fine for the diabetic patient?
Yes,
Yeah.
diabetic patients are normal human being. They can enjoy their life, but yes, they have to do minimum 30 minutes physical activity
Every day.
every day or 150 minutes a week. It is minimum. And it should be in any form, be it in walking, jogging, cycling, gymming, whatever they feel like. It should not be any excuse ki today morning I forgot or today there is raining. Do it in afternoon, do it at night, but 30 minutes is mandatory. And if the patient is obese or overweight, then it should be minimum 1 hour, 45 minutes to 1 hour.
So, doctor, now please tell our viewers about, how does diabetes affects the heart or the kidney? So, how is it related?
Yes, see, diabetes itself is they don't have anything.
Yeah.
Until unless at the time of diagnosis, the people are not aware of, they might have all these symptoms and these things. But once the medication started, all the symptoms is gone, they can be a normal human being. But if the diabetes is not controlled over a period of time, it may involve all the vital organs, not only heart. It's starting from eye, it may cause retinopathy that may lead to permanent blindness. It may cause heart blockage, cardiac arrest, heart disease. The patient may have a stroke. There is a very high rate of amputation, loss of limb because of diabetes. And we all know about the kidney disease. We come across many times that some family member or someone is having dialysis. So these are the factors are long-term complication of diabetes. If diabetes is not controlled over a period of time, then people may suffer with these things.
So, they are all connected.
Yeah, all connected. All organs get involved. If the blood sugar is not controlled, but it is over the period of time. We should not scare our viewer. If they control their blood sugar, they do exercise regularly, if they have balanced diet and they check their blood sugar in regular interval, then these things can be prevented.
So, how often should a diabetic patient check their sugar levels?
Yes, that is also very important. If someone is on insulin, then we'll ask them to have self-monitoring of blood sugar. That is the instrument glucometer they use to check at home. Or those who are on tablet, they can check it after a month or twice. Other than that, there is a special test called glycolytic hemoglobin that need to be checked every 3 months. And only checking blood sugar is not enough. We always advise our patient, as I have said, their diabetes long-term complications are involving the vital organ. That vital organs is also need to be screened yearly basis. Suppose they need to go to a eye specialist to check their retina once in a year. They should check their kidney, they should check their heart. It is not like I just check my blood sugar and it is okay, then I sit and relax. Then every year this vital organ also need to be screened.
So, yearly body checkup is very,
all vital
necessary,
organ need to be
for
checked.
a diabetic patient.
Diabetic patient.
Just to check, because diabetic itself, it doesn't have any,
Exactly.
bad effects, but it will affect the other organs, isn't it?
Exactly.
All right. So, doctor, can you give a few, few tips to manage diabetes for all the viewers of Northeast Live?
Yes. So, it is for the diabetic, and those who are not diabetic also, they can be like, remember few things. The first thing is do exercise regularly. It may be in any form. You may do by walking, cycling, jogging. Eat healthy thing. Avoid processed food. And the most important is try to be a stress-free life. Mental health is also very important.
So, sleep is also
Exactly. Mental
how
health.
important is sleep for
Yes,
diabetes?
see, diabetes, stress. I used to tell my patient, having stress and having rasgulla or any form of sweeties will have same effect. So, if people sleep nicely, if they have mentally free and they don't have any anxiety, it is definitely going to help to control their blood sugar. Even those who are not diabetic, they will be like they save themselves to become a diabetes. So, stress is very important factor.
So, diabetes is, it's nothing, it's like normal, because
Exactly.
the things that you have told today, a normal person can also follow all these things to lead
Exactly.
a healthy life.
Exactly.
Right. All right, viewers. So, on that note, we have come to end of this special broadcast. So, thank you so much, Dr. Nasimur Riaz, for joining me at this special broadcast. So, I'm sure this show will be very beneficial for all the viewers of Northeast Live, as diabetes is very common nowadays, and this tips given by Dr. Nasimur Riaz will be very beneficial if you follow this. So, on that note, it's a wrap. Keep watching Northeast Live for more news and updates. Stay with us. Thanks for watching.